Hey guys, this is BreeAnn, Allred, physical therapist and pelvic health specialist with Yada Yada. I want to talk to you a little bit about pelvic floor exercises and how often and how much we should do them. Now, this is still an area of much debate within physical therapy in general, and there's some research that's coming out to kind of give us various theories on this. So one thing we do know is that we need to do around 24 contractions per day at minimum to be able to gain strength in the pelvic floor. Now, if we're looking to maintain strength, that can probably be closer to about 10 repetitions per day. So oftentimes these are done on a daily basis. I recommend about 3 sessions per day ideally. Occasionally, if you're wanting to build strength a little bit more, we could recommend up to 5, but really we like to stick to about 3, giving you kind of the ideal spot to gain strength and improve function without over fatiguing these muscles. So a minimum of 24 contractions per day. I typically will recommend an average of 60 for most people. So when we're looking at pelvic floor exercises, I would split these into 2 types of exercises. The first type of exercises that you're going to want to do is a quick type contractions. So this accounts for about 30% of our pelvic floor muscle fibers. They're the sprinters in the pelvic floor. They respond hard and fast and quick, and then their job is done. So they don't have to stay on for a long period, but when we need them, they need to come on hard and fast. So examples for this would be with like a cough, a sneeze, jumping, when you're startled, if you laugh really, really hard, or sometimes yelling could be another example of when we would need these type of contractions. So with this, I would recommend that you would do about 10 repetitions of quick succession. So you'd squeeze and relax and squeeze and relax, and you'd continue that for 10 repetitions. That would account for 1 session of our quick flick exercises. Our second type of pelvic floor contraction is more of a holding or endurance contraction. These guys are our marathon runners. They're on a little bit all the time, and then they kick on a little bit more and hold for longer periods. When we have an urge that we need to go to the bathroom, they help us hold it on the way. So in order to train these types of muscles, what we need to do is we need to contract and hold this contraction for about 10 seconds. Now, if you're just starting out, you may find that you can only do a 3 or 5 second hold, and that's okay. We like to meet our body where it is and train it there, and then start to work up. If you're starting out in a 10-second hold, oftentimes you're going to be using other muscles to compensate for the pelvic floor, and actually then in that case, the pelvic floor doesn't actually get stronger. Your helper muscles get stronger. So start and meet your body where it is, and it may be 3 or 5 second holds, but working up to a 10-second hold, and then giving it a 10-second rest, and then repeating that 10 times. So 10-second holds, 10-second rests, repeated 10 times would be a 1 session of the endurance contractions. So if we're combining these 2 together, you can do them together for 1 session of exercise throughout the day. And once again, ideally for building strength, we would do at least 3 of those in a day. So with that exercise will take you 1.5 minutes to 2.5 minutes, depending on your rest time between. So I tell my patients, and I tell people that are really struggling with pelvic floor issues, these exercises are easy to do, they require no equipment, and they can really be done in any position that you're doing. And it will take a total of about 6 to 8 minutes of total exercise in about 1.5 to 2 minute sessions throughout the day. So they're very doable exercises, and they can be very, very beneficial in addressing any issues that you're having with your pelvic floor.